Hello everybody and welcome to the 3-minute series of the Italian study group on craniomandibular disorders. Today we are going to deal with bruxism, which is one of the hottest topics in dentistry, and we will focus on the fact that etiology is unrelated with the clinical consequences of such phenomena. Let's start with the definition. In 2013, an expert consensus paper was published in the Journal of Oral Rehabilitation to define bruxism as a repetitive motor phenomenon that is characterized by different jaw muscular activities: clenching of the teeth, grinding of the teeth, bracing of the mandible, which means keeping the jaw muscles tense without teeth contact, and thrusting of the mandible, which means the act of grinding without having teeth contact. Bruxism may also have two distinct circadian manifestations, since it may occur during sleep or during wakefulness. Coming back to the definition, it is important to understand that clenching and grinding, which are respectively identified on the left and on the right of the slide, are two different entities from a motor viewpoint, and they may be related with different clinical consequences. For instance, whilst keeping the jaw muscles tense for a prolonged period of times may be enough for fatiguing the jaw muscles and overloading the temporomandibular joint, it is quite obvious that bruxism events such as the grinding event we can see on the right side of the screen are not enough to damage the stomatognatic structure, with the exception of tooth wear. So it is important, if we want to get deeper into the study of clinical consequences, that we understand that bruxism is not a unique entity. It may be a physiological phenomenon. Let's think to the complex sleep architecture in children. It may be a mirror of underlying disorders. Emotional tension is related with awake clenching, or even be a protective factor in some patients, not all patients, with obstructive sleep apnea. It may be the consequence of drugs or substances, selective inhibitor of the serotonin reuptake, caffeine, nicotine, alcohol, and it may be the manifestation of other primary motor disorders. Think about Parkinson's disease, for example. If you want to grasp more, find it during all Italian study group of craniomandibular disorder activities and events. Stay tuned.